Hello, everyone. It's September 14th. I'm here at my office in New York City. The days keep just clipping by. Today, we're going to play a pre-recorded interview with Josh Weiner with SR Health. He's an interesting fellow. I'm sure that you'll enjoy that interview. But before we get to that interview, let's take just a couple minutes and look at some news stories that are appearing this week in Healthcare Business News Online today, as a matter of fact, not only this week, but today. First of all, you see that there's a story about how a portable MR is being used to detect brain abnormalities, indicating that a stroke or neurological disorders. We continue to strive and come up with new technology, and we're lucky to be living in this age. Another story, which is really interesting to me, noteworthy to me, is that Myron Technologies has acquired Biodex Medical Systems. And Biodex has been a private company under the leadership of James Reese, for many years, for I think as long as I've been in the business almost. And Jamie is a really charming and wonderful guy. And the company has been sold to Myron, and they're going to make a big investment. They bought some other companies. This is really news in the molecular imaging field. So you probably want to read that story. Hello, everyone. Today, I'd like to welcome Josh Weiner, who is the CEO of SR Health. Josh, thanks for joining us today.
It's really great to be here, Phil.
And Josh his company is an innovative company that's right on the cutting edge. And today he's in Utah, if I'm not mistaken. I wish I was there with him.
That's exactly right. Yeah, we had a big windstorm come through, and it's telling us that the hot summer's over and fall is starting up here.
So Josh, just for those of our viewers not familiar with what SR Health does, can you give us an overview of what the company is about?
Yeah, I would love to. Our mission is to transform healthcare through communication. We believe that many other problems have gotten great attention in healthcare, but the problem of communication has been an afterthought in many cases. And our goal is to enable provider organizations to communicate effectively and efficiently with their patients, with the means that are most convenient and effective for those patients, predominantly text messaging, but we do a lot of other forms of communication as well. Our software sits on top of the electronic medical record, so we pull all of the necessary data that we would need and that those provider organizations would need in order to drive really essential communications about healthcare to patients. And that ranges from virtual care services that we offer to many other healthcare related communications that you can imagine over the course of the healthcare journey.
Now, what challenges are hospitals facing, healthcare providers facing right now as it relates to communicating with their patients?
Yeah, I think the biggest one was, when we suspended most of our healthcare operations in April and May, in order to keep moving forward, healthcare organizations, they needed to accelerate their virtual care services and their telehealth services so quickly that they grabbed for whatever solution was most readily available without having time to figure out what process was really going to work and make virtual care and telehealth sustainable over time. So you asked what's the biggest problem that they face. In my view, it's figuring out how to operate efficiently and effectively in a world where you've got to keep staff and patients much safer than maybe you'd thought of before. And so there are a bunch of new constraints that have been introduced. And so you had this rush to where all of a sudden 80 or 90% of appointments in some cases were converted to telehealth. Now what we are seeing is that leveling off at somewhere like 40 to 50% of appointments are now being done virtually, and provider organizations don't have the sustainable set of tools and processes to shift their impressive but very large unwieldy operations into that environment. And so that's a flavor of the type of problem we are working with provider organizations to solve.
I know that in our other conversations that we had before we started the interview, that you talked about how it's important to have best practices or a protocol, because it's not only the software that does the work, but it's helping the hospital to configure the software and implement this into their facility. How long does something like that take, and how difficult is that?
That's a great question. I couldn't have agreed more with the premise that software is only as good as the people and process that are molded around it. And so from an implementation perspective, you know, we have what we call an emergency communications package that we can get going within 24 hours. And so this is for organizations that are unable to communicate one to many, and they may need to get an essential message out via text message to all 150,000 or 2 million of their patients. That we can do within a matter of hours, because what we're doing is we're taking essentially a spreadsheet of data and then driving a communication off of that. Now, to get the longer term solution in place, we would always recommend taking 3 to 6 months really to think it through and make sure your integration touch points are configured like you're describing, configured in a way that the data is working the way that it needs to and the process is set up in the way that it needs to. So that's often a typical path that we'll take, is we'll say, let's get something in place this week. Doesn't need to be perfect, but as we do that, let's build out the 3 to 6 month timeline.
I see. It's got to be, you probably need buy-in. Who are the stakeholders in that process?
Yeah, what we're seeing is that it's a business partnership across operations, clinical, and IT. And very often that's going to require kind of senior executive, you know, from a CEO and CFO perspective, buy-in. But what we're seeing are operational and clinical leaders really driving the discussion forward as a team.
So, Josh, tell me, how do you think this sort of communications will change the way healthcare delivery takes place in the future?
We've had a lot of these tools for some time to be able to deliver healthcare virtually and then communicate on an asynchronous basis, meaning text message, I can respond, pick it up when it's convenient for me. The provider can pick it up when it's convenient for them. We've had a lot of these tools available. And yet, for many important reasons, healthcare has been slower to adopt these tools than other industries. And that's really accelerated this year. And so what we're forecasting is that virtual care, or a form of hybrid care where there's fluidity between in-person care and then virtualized events that happen, that's upon us. That's already upon us, and it's not going anywhere. Because what now organizations are doing is they're saying, how I need to invest in the resources and processes to support that long term. And those were the fundamental roadblocks before, because we've got really hardworking, mission-driven healthcare leaders running these organizations, and the complexity and barriers are many for them. And this year was a wake-up call to say, all right, now is the time to go. And a lot of those barriers have been removed. And so that, when you think about the different, how it'll be delivered. I'd come back to these concepts of hybrid care, and just heightened expectations from patients that information and communication is got to be available on their mobile device.
So we've accelerated the acceptance because of the crisis.
I completely agree with that statement. Yes.
I mean, I'm asking, I'm just,
No,
that's my takeaway from what you just said.
yeah, I mean, you've got what executives at hospital systems are telling us is that virtual care will not go below 40% of their appointment volume. There's tremendous variation depending on which appointment type and which medical specialty we're talking about. You'll have some specialties where it's going to be closer to 100%, others where it's closer to 0%. But netting out at around that 40%, 50% number is amazing.
That's to say that 40 to 50% of the people, 40 to 50% of patients utilize this type of technology.
I would think about it a little bit differently. I would think of yourself as a provider, and you might think of 40% of your calendar for the day is going to be working with patients on a remote basis, and 50 to 60% is going to be sitting down conducting in-person healthcare.
And what percentage of the people do you think will utilize the idea of text yesterday, I have to go to the doctor tomorrow, and I received a text last week saying, are you going to show up? And do you have a fever?
Mm-hmm.
And are you still as handsome as you used to be, or some other questions, right? And I was able to, on my phone, answer those questions through my hospital interface. What percentage of the people do you think will do that and learn to do that? A high percentage, low percentage, medium? Any idea?
Yeah, it's going to get very close to 100% in the years to come. And the research that we've done has shown that there's some variation as it relates to age and socioeconomics and other demographic variables that might drive adoption pace, but not much. There is not much variation. There's pretty much universal acceptance that it's the right way to do it. Not only is it the safe way to do it, but from a contactless perspective, but it's the right way to do it from a convenience perspective. One stat I'd give you, we've got a very similar solution that we deliver for our clients, which is called digital intake. So ahead of your appointment, we've got a flow that offers up a series of questions and forms that patients can fill out on their mobile device, and that data gets fed back to the hospital system. And usage of that intake solution has gone up 20 times since February. And it's gone up for two reasons. It's gone up in terms of the willingness of patients to fill it out. So now they're twice as likely to fill it out when they get that request for the information, twice as likely. So it went from 25% of the time completion rate to 50% completion rate. But on the other side, providers are 10 times more likely to send that form digitally versus the clipboard and paper.
Well, it sounds, Josh, like you have a lot of experience under your belt, and you've probably made all the mistakes that anybody could make, so you don't make them anymore, and that's a good thing.
I don't know about that.
Right, well, let's hope so anyway. Certainly you have a head start on the rest of us. So it's very nice visiting with you. Thank you very much for joining us, and we hope you'll come back when this is all over and tell us what you learned.
It's been a real pleasure. We'd like to think that every day we continue to learn more and more about the future of healthcare that we want to help shape with our customers and our partners. And it was a thrill to get to know you today, and it was a great conversation.
All right. Well, thank you very much, Josh.